Please note, although this information is directed at men, it's great advice for women too. There is room for everybody here. Let's get to it. Hi guys, I'm Dr. Bree and welcome to Q&A Thursday. Today I want to tackle a question that is actually from a segment of readers and YouTube followers that have been kind of underrepresented in my videos, and that is the men. Lately I've been getting a lot more questions from the male viewers who are out there looking for help with pelvic pain and pelvic floor dysfunction issues. Pelvic pain and pelvic floor dysfunction is a common issue in women, but it also happens to men as well. So I'll start off by reading a question that I recently received from a viewer. But before that, I want to just begin by telling the males out there that you must always start off this journey exploring whether or not there's something else going on, some other medical issue. A lot of times pelvic pain and often tension in the pelvis occurs because of some other condition. You want to just be sure that you don't have any type of prostate issue or any other condition that needs to be first addressed by your medical provider. After you have assessed that perhaps it's not a medical condition that a physician needs to treat, or you've assessed that that condition has been treated, but yet you have lingering pain or dysfunction such as difficulty urinating or initiating the stream of urine, painful sex or erectile dysfunction issues, or pain when you're sitting or standing or walking around, or anything like that, you can consider what I'm about to share with you. But again, just be sure that you have cleared your condition first with a healthcare provider who knows a lot about the urogenital area. So you might want to consider seeing a urologist or a proctologist or somebody who really knows this area of the body, can make sure that there's nothing else going on. So here's the question from the viewer. He says, "Hi Dr. Bree, I am a male in my 40s suffering from chronic pelvic pain for the last 10 years, now living in Canada. As you can well imagine, I've been to multiple doctors, taken multiple antibiotics, painkillers, and muscle relaxants over the years. One of the doctors identified it as pudendal nerve entrapment. I worked with a physical therapist when I lived in the USA, and during the same time, I've also been through 3 nerve block injections, which did not help. I traveled and talked to various doctors in different parts of the United States, and I go through episodes of severe pain from time to time, and sitting, of course, makes it worse. I saw your video today, and this, he's referring to the pelvic stretching video that I have, the pelvic release video, which I'll link in the notes below. I saw your video today and will practice the 30-minute routine with the hope that this will help. Do you recommend any other methods that can help? Thanks and regards." This person who wrote to me has obviously been through the ringer and been through the rounds of seeing various healthcare providers. He has already worked with a physical therapist, which is definitely one of my first lines of treatment that I would recommend to anybody out there who it's been cleared that there's not a medical condition going on, but that there is lingering or perhaps just persistent, for some reason, tension in the pelvic muscles. So if that's the case for you, then seeing a women's health physical therapist or a pelvic floor physical therapist can be extremely helpful because they can do the internal myofascial release and external myofascial release to the muscles surrounding that area that can really help release tension with manual therapy techniques, hands-on techniques. They'll also give you relaxation techniques perhaps and stretching exercises, maybe strengthening exercises. It really depends on the person. So that's my first suggestion, is to find a physical therapist who can work with you, who specializes in pelvic floor dysfunction. My second suggestion is to take matters into your own hands and do stretching on a regular basis. And by that, I mean at least 3 times a week, possibly 4 or 5 even, maybe even every day if it's a shortened routine. Now, I have several videos that I've done that could be helpful for you, so I will link them in the notes below. The other thing that you can do is a very brief stretching routine that you can do maybe even twice or 3 times throughout the day. Now, what I would do is pick a couple of the stretches that really work well for your body, the ones that make you just say, ah, and relax and release into it. This is going to be different for everyone. but you want something that's really going to open up the pelvic floor and really release that area. So two of my favorites include the frog stretch and puppy pose. Now both of these require being on the ground, so it might not be the most feasible if you work in an office all day long to do this in the middle of the day, but perhaps you can do it in the morning and the evening every day if you don't have time for the full 30-minute or 20-minute stretching routine that really gets you great results as well. I'm just giving you two suggestions of poses that can be quick kind of go-to poses for you, but you can choose what you like. Let me just show you briefly what I am referring to. So the frog pose is when you are on your back, you grab through the inside of one leg to the outer foot, and then through the inside of the other leg to the outer foot, and you just let your legs open. Now, if that's too much of a stretch and it feels just difficult in your hips, then you can also hold on to your legs like so, but that might be too aggravating for the groin area. It might be too much of a stretch for the inner thigh muscles. So just kind of play with this. You can also play with one leg up at a time and then the other leg up. You want to always go slow, breathe deeply, and relax. Don't rush it. There is no reason. It's not going to help if you rush it. So really relax into it. The next pose, which is a really great pelvic floor release stretch, is puppy pose. And that is where you are on your forearms. Your forearms are on the ground. Arms are parallel like railroad tracks, forearms. They're on the ground. Then you just walk your knees back with your bottom up in the air. You can also move your arms forward. And ultimately, you want your hips over your knees and your sit bones, your sitting bones, widening apart. And with that pose, you can also put your forehead on a block or a pillow just to make it a little more comfortable. So the gist of what I'm saying here is to stretch. Do your own stretching program, whether it's a 20 to 30-minute program you do 3 to 4 times a week, once a day, or my kitty came to visit, or if it's a very brief stretching routine that you hold each stretch, maybe 2 or 3 stretches for 30 seconds to a minute each stretch. So again, we're talking 3 minutes total, 2 minutes total. If you do that twice or even 3 times a day, that can be really helpful as well. The other aspect you want to consider is your breathing. So today I'm wearing a t-shirt that says just breathe, and it's really important because what you want to focus on is not just relaxing the pelvic floor and opening the pelvic floor, but you want to work on full body relaxation. When you have chronic pain, whether it's in the pelvic area or really anywhere, your entire body is amped up as far as central sensitization, as far as arousal of the nervous system and the pain sensations, pain receptors. So you want to tone everything down globally by global relaxation techniques, and breathing is a great place to start. One of the best relaxing breathing techniques is a diaphragmatic breath. So that is where you think about breathing in and filling your belly with air, letting everything expand. Now, to bring this into the pelvic floor, I want you to think about expanding out and back and also down as you breathe in. As you exhale, lift the pelvic floor gently. It's not a kegel or a contraction of the muscles. It's just a gentle lift and a gentle pulling and drawing in of the abdominal area. So it's a breathing in and everything expands 360 degrees like a big balloon, downward, forward, sideward, and backward. And then when you exhale, breathe out, everything comes back in. It's like you're helping to push the air up. So if you do that in a lying down position, maybe with your knees, some blocks under your knees or a rolled up blanket or yoga mat under your knees to support your back and just make you more comfortable, that can be really helpful as well. These techniques don't have to take long. We're talking maybe a minute of breathing and the couple minutes of stretching. But if you do them consistently, that is what's going to, over time, globally calm your body down. The next thing you want to consider is your bowel and bladder habits. So, are you having to strain to have a bowel movement every day? If so, you want to consider how to work on your diet and your fluid intake so that you don't have to strain to pass your bowel movements. It's something that nobody really likes to think about or talk about, but it's really important. If you are having constipated bowel movements or if you're having diarrhea and it's irritating, you want to figure out how to resolve that. Now that is much bigger and broader than this video can explain, but you want to look into your diet, definitely be eating loads of fruits and vegetables. If you're having diarrhea, you might want to consider making them more of a cooked fruits and vegetable situation, like cooked steamed squash, steamed vegetables. They can be a little bit less rough on your digestive system. If you are constipated, you want to be sure you're drinking plenty of fluid and that you're eating plenty of fibrous vegetables, maybe a mixture of raw and cooked vegetables. Be careful with overdoing the grains. For some people, those can be irritating to the gut. And so I really recommend people get so much of their fiber from fruits and vegetables first. We also want to look at bladder habits. So are you, again, drinking enough water so that you are filling your bladder, flushing everything through regularly and not feeling very, very dehydrated, not having to feel that sensation of, well, there's a little bit in there, but I almost have to push to get it out, and that can make the feeling of difficulty initiating the stream of urine even worse. So some people, when they have urinary issues, they don't want to drink because they don't want to have to deal with this issue that's causing them so much grief. But that's actually counterproductive because it's going to cause its own set of problems, dehydration, sometimes constipation, and again, just that feeling of, well, I've got to go, but only a little bit. And so then you end up kind of having to push, your bladder's not really full enough to have that need to eliminate anyway. So drink enough water. You want to drink sufficient water so that you're not constipated, you're plenty hydrated, and that you're able to urinate regularly throughout the day. You also want to look at the foods you eat as far as, are they inflammatory to my body? Are you eating foods that you are allergic to and you don't maybe even know? Sometimes working with a nutritionist to do an elimination diet to discover hidden food sensitivities or food allergies can be helpful, because when you are filling your body with these foods, it can actually change all sorts of things, from your hormone balance to your mood to the general state of inflammation in your body, which can raise or lower your pain threshold. So you really want to cut out the processed junk. Eliminate sugar as much as you can. Refined sugar can be so inflammatory to so many people. And again, look into possible food sensitivities or food allergies that you may not be aware of. Gluten, dairy, soy are some common ones, eggs. There's all sorts of common allergens that you may have an issue with, and honestly, it's better to cut it out of your diet than to deal with the condition that you're dealing with now. It's worth it, I promise. The last thing I want to do is just support you in the practice of self-care. I think that women often talk about self-care in relation to themselves and treating themselves, and it's easier to give a list of self-care ideas to a woman that may not be appealing to a man. A scented bubble bath, or, you know, a spa day with your girlfriends. Now, those things very well might feel appealing to you, a spa day or a nice bath, but if it's not something you immediately think of, I encourage you to make a list of 4 or 5 things that really feed your soul and make you feel calm and relaxed. Whatever it is for you, you want it to be something that is calming and not stimulating, something that you can just fully let go into the flow of the moment. And honestly, that's going to do wonders. Just lifting your mood and being happier and taking care of yourself is going to do wonders as far as pain control. And knowing that you're not making this up, you're not crazy, there is help out there, but there are steps you're going to have to take on your own to take matters into your own hands and take care of yourself. Because honestly, when you take care of yourself, there's more of you to go around to all the people that are around you, your wife, your partner, your children, your animals, whatever it is, your work. You need to take care of you. So it's a message women receive. Women don't even receive it enough, but I also feel that men don't receive it either. So relax and take care of yourself. Remember to breathe, remember to stretch, Remember to see a physical therapist if you have not already. Consider your bowel and your bladder habits and to make sure you're not eating inflammatory foods. And I hope that helps. I hope to have more videos to come in the future with other experts in the field who really work on a day-to-day basis with men, particularly in relation to the pelvic floor and pelvic health in general for men. So I don't have all the answers, not even close. I wish I did, but since I don't, I hope to bring on more experts in the future. Until then, though, I hope these tips have helped you. And if you have specific questions, please let me know by going to my website, femfusionfitness.com, and hitting the contact area, the contact button. And you can also just send me a message directly here in the comments below this video. So thanks for watching, and we will see you next time. Bye.